Hey guys, a lot of talk and excitement about Parkinson's in the last month and a couple of studies we should talk about. So this study was funded by the Michael J. Fox Foundation, and Michael J. Fox is an actor who many of you know who got Parkinson's unfortunately at the age of 29 only, which is a very unusual early onset form of Parkinson's disease, but he has formed a foundation and really been an advocate for this disease and raised over $1 billion for Parkinson's disease research. This particular study, I think, was really important because it's the first study to identify what's called a biomarker for Parkinson's disease. So until now, the diagnosis of Parkinson's disease was a clinical diagnosis. In other words, you see the patient, get the history, do the physical exam, do some imaging, rule out other causes, and conclude that they probably have Parkinson's. What they've done with this study is that they've presented a test that with an accuracy of 93% can tell you if you have Parkinson's disease. So this obviously becomes really important for patients in terms of knowing whether they have the disease or not and their prognosis and moving forward. But it also becomes important for research because it means that we're more likely to have the right people in studies, people who actually have the disease. And we're also really interested because the study suggests that this biomarker, which is called alpha-synuclein, it's a protein that becomes misfolded in Parkinson's disease and accumulates in the brain. Being able to detect this can actually be really important because they found that it was found in elevated levels even in very early stages of the disease, which means that when people are showing very early stages or even people at high risk, for example, due to a family history, if you can find this and diagnose this predisposition to developing full-blown Parkinson's, you might be able to intervene and treat before they develop it. So it's the beginning of a possibility of a true cure to prevent full-blown Parkinson's disease. The other study I want to mention is this study that looked at a very specific chemical called trichloroethylene. Now, this is a chemical that previously has been described as potentially causing an increased risk of Parkinson's disease, and there have been several different chemicals like this that have been studied. In this particular study, they looked at a military camp called Lejeune. This is a camp in North Carolina where, unfortunately, between 1975 and 1985, the water supply was contaminated. It was contaminated with very high levels of this TCE. In fact, 70 times the upper limit of normal. So they looked at all of the military personnel who were in that camp and exposed to that water and compared them to people at another camp and found that indeed they had a 70% higher risk of developing Parkinson's if they had had that exposure. Now, what's important here is that even those who had that exposure still only had a 0.3% chance of getting Parkinson's disease. So obviously this, like many other chronic diseases, is going to be a complex interplay between people's genetics and what they're exposed to in the environment. And this is something we are still learning more about, but thanks to people like Michael J. Fox, the science is moving forward.